Title research is Influence of Prosthodontic Rehabilitation upon Zygomatic Implants in COVID-19 related mucormycosis, which is Rhino, Orbital, Cerebral, Maxillectomy patients upon post-operative stress, anxiety, and functional impairment. It is a prospective cohort study. The purpose of the research is to determine the influence of prosthodontic rehabilitation by using zygomatic implants in partial maxillectomy upon post-operative stress, anxiety, and functional impairment due to COVID-19 associated rhino-orbital cerebral mucormycosis, also called as black fungus. The patients and methods included 20 maxillectomy patients fulfilling study criterion who received zygomatic implants, quad zygoma, ZDI, Simpladent, Switzerland that retained and supported a complete maxillary denture. The assessment of stress, anxiety, masticatory performance, and speech were determined using diurnal salivary cortisol level, appearance, anxiety inventory, multiple seat technique, and auditory perception analysis, respectively. The data was recorded at 6 different stages of rehabilitation, which is after maxillectomy, implant placement, and after prosthesis delivery, which were 1 week, 1 month, 6 months, and 1 year. The demographic data was expressed as frequency distribution, while mean values were used to find the differences between various rehabilitation stages using Friedman and chi-square test with statistical significance value at p is equal or less than 0.05. The results show that average daily salivary cortisol levels declined from post-maxillectomy, which was 22.80 plus minus the standard deviation 0.902 to 1 year after prosthesis varying 8.65 plus 0.985, indicating stress reduction after zygomatic rehabilitation. Mean scores for appearance anxiety reduced from pre-prosthetic rehabilitation 27.350 to 1 year 8.950 following prosthesis vary. Functional parameters for mastication and speech also improved significantly during the course of rehabilitation. All differences between pre-prosthetic to 1 year stage after prosthesis varying were found to be statistically significant at p is equal or less than 0.05. The conclusion of the study is the post-rhino-orbital cerebral mucormycosis maxillectomy cases after prosthetic rehabilitation using zygomatic implant showed significant improvement in the psychological stress and anxiety as well as function, mastication, and speech characteristics. Rehabilitation post-ROCM maxillectomy with the present approach of fixed prosthesis using zygomatic implants mitigates deficient mastication and speech. It also impacts positively on patient psychology by decreasing stress and anxiety. An exemplary case is presented here. You see that the extraoral frontal view of an exemplary patient who has undergone maxillectomy related mid-facial deformity. This is the lateral view of the same patient. This is the CBCT scan for locating zygomatic bone, both qualitatively and quantitatively. This is the 3D printed more acrylic model seen from A. This is front, back. Then there is mock implant placement. These are 4 mock implant placement in the 3-dimensional acrylic models. This is virtual surgical and prosthetic treatment planning using ExoCAD, isolated planned fixture superimposed on underlying bone, and horizontal view of planned fixture, and finally the abutment. This is the surgical exposure of zygomatic bone, implants welded using solid bars, then impression caps are in place. Prosthesis design as seen on CBCT and orthopantogram with the framework. This is the final prosthesis, the intraoral views showing zygomatic implant retained maxillary prosthesis against natural dentition. This is in centric occlusion to check the occlusion, and this is the frontal view. You see the midfacial deformity is gone, and this is the lateral view which has restored the midfacial area. Thank you very much.